I'd like to talk to you about a really alarming trend that we've seen develop over the last few years. Now, as the aesthetic industry has matured and as treatments have become better and better and people are getting regular treatments, we start to feel that it's normal to have Botox. It's an everyday occurrence to go and have some fillers. And more people are seeking to get these treatments on TikTok, off the internet, off counterfeit websites, so they can get cheaper treatments at home. There's a real danger with this because a lot of these products are regulated and we can only get them through prescriptions and through verified sources. Getting things online, through TikTok, through unverified sources can put people at real risk. There have been cases where counterfeit Botox has been so strong that it's caused paralysis and it's caused death. Fillers can be contaminated. They can have toxins in them, and usually cheap fillers mean that the manufacturing process has been cheap. They've not been sterilized properly, they've not come from a verified source, and they can create real problems for the future. I find it incredible that people will put not just how they look and their features at risk just to save pennies, but also put their lives at risk in doing so. Let's talk a little bit about Botox. Botox is a prescribed medication. The way it works is that it weakens nerves by inhibiting signals from the nerves to the muscles, and it has to be stored in a certain way. It's got to be reconstituted very precisely by somebody who knows what they're doing, and even the way that we inject it has to be in a particular way. Even a small amount of Botox can cause asymmetry, which can last about 3 months. However, when the wrong dose is injected into the wrong muscles, we can get real problems, particularly if it starts to affect the breathing and the swallowing of the patient. Don't forget, Botox is one of the most toxic substances known to man. 1 teaspoon is enough to kill 7 billion people if administered properly. There is a great trend at the moment for more and more people injecting injectables at home, Botox and fillers particularly. The risk of doing this can be tremendous and can result in serious injury, if not death. The home environment is not like a clinical environment in that with a clinical environment, we are guaranteed a clean environment. The products that we use are verified and the way they're reconstituted is very standard. The problem with home use is that at home, we're not really sure of the hygiene standards, so the infection risk can increase, especially if you're injecting fillers into the face. If you get an injection, particularly in this mask area, there is a risk of that infection going backwards towards the brain and causing meningitis and even death. We know that an intravascular injection is more likely to happen when somebody who isn't properly trained in anatomy is doing the injections. If this happens, that can travel then towards the circle of Willis around the brain, and it can occlude the vasculature to the nerve of vision. This can cause permanent blindness, and we've seen this more and more. And since more and more people have been injecting outside a clinical environment, there are regular cases being seen at the eye hospital with this complication. Also, the products being used are not verified, and if a side effect occurs, like an anaphylactic reaction or a strong dose of Botox is introduced and somebody stops breathing, then the people around may not be trained to recognize the emergency, and life-threatening complications can occur. So my advice to everybody would be, don't save pennies, go to a proper regulated clinic to have your treatment. Respect yourself enough to be able to do that. Going cheap with medical treatments is never a good idea. My recommendations would be safe. Get the best results in the safest environment. The reason why medical practitioners and clinics are regulated is because patient safety is at the core of the regulation. And we welcome that. We were self-regulating before. We have given ourselves to being regulated and being observed and being reviewed on a regular basis because we believe in our patient safety being our primary concern. The regulation's there for a reason. Yes, it costs a little bit more to be regulated, and that's transmitted to the price of the procedure. But from a patient's perspective, it's also very important because regulated practitioners not only are trained properly, they're reviewed on a regular basis, they are also insured. So if something does go wrong, firstly, they know what to do. They can recognize it, they can take the right action to protect the patient, and they can remedy the problem. But secondly, if, God forbid, anything long-term happens, the patient is protected. The patient is insured on the medical insurance or the clinic insurance of the establishment that they're going to. Secondly, it is actually illegal to perform medical prescribed treatments outside of a regulated facility. Now, there are treatments that are not regulated, such as fillers. Fillers are actually more dangerous than Botox. At least with Botox, unless you're overdosing and stopping somebody from breathing, you will get a side effect. You may get a droop, you may get an adverse outcome, but it's gone within 3 months. However, with fillers, you can lose vision. That's permanent. You can have a stroke. That's permanent. So what I would recommend is that you go to a regulated place for your own safety and your own peace of mind, and also to get the best outcomes. If you've had a treatment where something has gone wrong, it's really important to seek medical advice immediately. Now, this may be difficult if you've gone to an unregulated source for those treatments. If you've been to a regulated source, of course you've got recourse. Go back to your practitioner. If they're unable to correct it, they'll have other colleagues who'll have more experience and they'll be able to refer you to there. But even if you've been to an unregulated source, please contact a regulated clinic and ask for help. I believe that most practitioners will give you help, even if they've not carried out the treatment. They might be a bit annoyed, but they'll give you help because that's their ethics. They're doctors first and foremost, and our patients and anybody asking for help is where we give the help. So contact somebody, contact them quickly, get the right treatment, because if you delay things, long-term problems can occur. When we're talking about simple injectable treatments, my recommendations would be go to someone who knows what they're doing. Don't do these yourself. If things go wrong, don't try and correct them yourself, because somebody who's trained and has experience will be able to do that for you in a much better way. It's really not worth saving pennies and putting your health and your life at risk. So go to somebody who knows what they're doing.